Hello, my name is Svetlana Duprier. I work with Access to Funding Department in the Global Fund. I have been with the Global Fund for more than 10 years, and I'm really thrilled to launch this NFM4 and to update you on the preparation for the upcoming cycle. So welcome everybody. Today's session is a part of a series of information sessions on preparing for the next funding cycle. And this is about focus portfolios and specifically on applying with tailored for focus transition application approach and tailored for focus portfolios. This session is packed, so there is a lot of information to cover. Before starting walking you through the annexes and the funding request templates, we'll talk through the criteria for which components might be invited for focused for transition approach. Next, we'll go to the funding request form itself for tailored for focus portfolios, highlighting key areas which might need more information and attention. Then we will review the annexes, which are the same for both approaches. Then we'll touch on additional annexes that should be completed by applicants requested to use tailored for transition approach. Please be reminded you can pose your questions in the chat in any time. Me and my colleague David will be presenting, facilitating the sessions, but we also have other colleagues answering them throughout, and we will also take additional questions in the end. So let's get started. Before diving into the subjects of today's presentation, just a quick reminder that our preparations for the new materials started by listening to you, to the applicants, partners, and also our colleagues in the country teams. We have received 1,200 responses submitted through different surveys, and responses were overwhelmingly positive about the process of applying and forms used to apply. So that's why we didn't want to create a revolution, but to evolve the form. We ask you throughout, and we wanted to let you know that we hear you. Filling out funding request is a lot of work, we understand that, and we have done what we can to simplify things where we can. Especially for focus portfolios, we know that between funding requests and the TRP questions that are coming during the TRP review, there is a lot for you to focus, and we try to find helpful ways that we can differentiate. While we focus on addressing your feedback, we also have a new strategy, which is very ambitious, and our board has made clear that focus and attention is still needed across the global fund portfolios, meaning that we were a bit constrained in how to balance these two things out. But we wanted to let you know that we heard you, and hopefully you can see the result of some of this feedback in the application approaches. Just a reminder that you are here for tailored for focus and transition, so in the red box. We already ran a session on full review and program continuation earlier, and believe also for NSP earlier, and I believe recordings are available in case you would like to check them. Tailored for focus portfolios, so who they're designed for. These are for countries with smaller allocation amounts and disease burdens classified as focus portfolios as per the Global Fund categorization. So it's specifically designed for the focus portfolios. Next slide, please. Tailored for transition will be applicable for countries with specific criteria, as you see in the box below. Countries cannot opt out of the transition approach. So transition funding, what does it mean? So once a country disease component, not country component, funded under existing grant becomes ineligible, the component may receive transition funding, allowing their change in eligibility. Generally, this is for one allocation period. The funding request for transition funding grant must be based on transition work plan. So you also see in the box below who is requested to use transition for funding application approach and what are specific conditions. So I will not go through all of them. So it's either countries receiving transition funding, projecting to move to high income, etc. So transition pathways projected to move to upper middle income status with not high disease burden or countries projected to move to high income status. Low income and low middle income countries are eligible to receive an allocation irrespective of disease burden, while high impact, high income countries are ineligible regardless of disease burden. Upper middle income countries may be ineligible for one disease component while remaining eligible for other. So as I noted before, eligibility for funding is at the component level, not at the country level. Next slide, please. So the Global Fund strategy, our strategy that was newly approved. You have seen, you likely have seen this slides or this screenshot, this image of the strategy many times before, because this is not the first time that we are talking about the Global Fund strategy. But we would like to show you a different view perspective on the strategy. Strategy isn't the point of this session. For that, we encourage you also to, to go to consult our other presentations and training materials. We are introducing some of the new icons in relation to the strategy that we will show you throughout the presentation. Just how much, so it's just to make you understand how much the linkages are created between the Global Fund strategy and the new application materials. This helps illustrate how the expectations of the partnership have been realized in the materials for the new allocation cycle. So the icons that are on the right of the slide will be coming through in our presentation later slides when we will be talking about funding request application form itself. Next slide, please. Area of focus. One of the first things that you will see on the front page of the funding request form and throughout the form is the reference to the area of focus. So here it's highlighted in yellow. No, this is not the same as focus of application requirement, which is part of the SEC policy. The purpose of introducing this area of focus is to support you during your discussions within the CCM and partners, and to support the idea that for smaller portfolios, as in case for focus portfolios, we cannot and should not fund everything, but really drive for impact in critical areas. By already having an area of focus for investment, we can help focus the country dialogue and funding request development accordingly. It will also help TRP so they can plan their review and based on the specific area of focus. This will require conversation on what this or these areas of focus should be. And this conversation should be happening between the country representatives, the CCM and the country team. So determining the area of focus. CCMs should already start discussing with country teams and their key partners what these areas should be. This will be documented in the allocation letter or other official correspondence with the Global Fund. Hopefully, this communication will already be received as you begin the discussion of the funded request and the country dialogue planning process to ensure a drive for greater focus. Next slide, please. Thank you. The country dialogue process is how all stakeholders involved in the response or impacted by the three diseases come together, review progress and challenges, and agree on the best way forward to fight the three diseases in the context of these defined areas of focus, to focus the funding request and avoid spreading investments too thin. This process is led by the CCM rather than the Global Fund and can and should extend beyond just the CCM to include non-CCM members, civil society representatives, affected groups, health systems, disease experts to bring the most impact into fight against the three diseases. This inclusive engagement is a core principle of the Global Fund. It's not something new, and I hope everybody is aware of that. The Global Fund's new strategy introduced a number of key strategic shifts that resulted in new annexes to gather data and support these strategy areas. So on the right, we see the expected output from the funding request stage. If you don't remember seeing this before, please also review our recent training on the country dialogue. The recording is available. and some of the follow-ups from the dialogue, the program split. For example, isn't necessarily a country dialogue output, but is a decision by the CCM that should be informed by the dialogue. Next slide, please. Finally, we get to the forums themselves. Before diving in, we would like to mention the instructions and reiterate that these letters are essential for correctly populating the forms. So please read them carefully. Instructions is the best body of the funded request form. So please read them all together. As you see on this slide, the questions on the form is quite simple. But in order to answer each question, we have specific elements here in red, and this needs to be responded. Unless each of the requested elements is spoken to, the question will not be considered as complete. Next slide, please. So for each instruction, you will see the question elements, which each need to be answered in order for question to be considered complete. Each element has different details, which should be considered or spoken to when addressed the question element. Please pay particular attention to what is being requested in the details. This is explained in the instructions, but words like describe or indicate are asking you to please include or to refer to this information. In comparison to consider is intended to be prompts for areas for consideration. For this session, we will be discussing mostly about the questions themselves, only referring to the elements or details when there are areas we want you to look out for. We encourage you to look early at the instructions. By the way, they're already available on our website. So if you're interested, you can open them just after this session. And so you can make sure you really understand what is being asked. Next slide, please. So funding request form, section 1. So this, you might have seen this before, ask about prioritized requests and the rationale. First, for tailored for focused and transition forms, we start with the rationale, an overview what is being requested and why, was within allocation and beyond it. And then we go to country context, really focusing on what's new and different since the last funding request, the lessons that have been learned, and what have been changes, what have been changed as a result. Next slide, please. So question 1.1. So this is the level of, this table is asking you to present information at level of modules and intervention. This means that for all of specific types of interventions should be shown together. So for example, the intervention might be condom and lubricant programming. The applicant may have this for transgender people, sex workers, men who have sex with men, people who use drugs, etc. For all of this should be shown together as one intervention in the table. We recognize this might look different on how the information is presented in the performance framework, where modules and intervention are by population. But including this information aggregated at the kind of module level will help also a TRP review of the request. As mentioned earlier, the request here needs to be aligned with the defined areas of focus from either allocation letter or other official correspondence from the Global Fund. So remember this yellow thing that was highlighted on the cover page. The example of, So finally, we wanted to mention that we also will be updating forms slightly in November or later this year to shift the access of the tables. So please, please watch out. This is not a content change, but mainly to improve readability. Payment for results. Payment for results is a modality in which the Global Fund makes payments based on the verification of results being achieved. This approach allows for flexible use of grant funds with the pre-agreed parameters and is not based on monitoring and managing inputs. When responding to this question, applicants should only consider payment for results at the level of the program. Any proposed use of incentive payments as facility provider level of individual basis should not be included here. They should be included in the section 3 under implementation arrangements. If no payment for results modalities are used, because these are not used everywhere consistently across all portfolios, please delete the table and respond with no payment for results modalities are used. Section 1.2, contextual rationale. This section on rationale and context is really important and is trying to clearly link what is requested with what has changed in the country since the last time the TRP looked at the funded request for this component. So the TRP already has looked at the previous funded request, so applicants don't have to repeat everything, you know, since the start of the funding of program by the Global Fund. Just really focus on what is different, specifically looking at areas of change that might impact the disease programs or the communities. Prioritized interventions can be referred by the intervention number from the previous table, table 1.1. And for reference, you may attach any other documentation, for example, analysis, prioritization exercise, etc., which inform response to the questions. Focus of application requirement. As a reminder, this is not the same thing that areas of focus for the focus portfolios. Focus of application requirements require applicants to focus all or part of their funding request on key and vulnerable populations and or highest impact interventions within defined epidemiological context. These requirements are described in the STC guidance note. Specific requirements pertaining to your particular country situation will be also explained in the allocation letter. Matching funds. This is section only for applicants who are receiving matching funds. If you don't receive matching funds, you don't have to answer this question. Question should be repeated if you receive funds for more than matching funds area. We ask you to describe how matching funds help achieve highest impact and improved outcome of allocation, and how conditions are met in case you have received matching funds in the past. We will also be issuing specific guidance on matching funds later. Section 2, maximizing impact. So what is this section about? It's about strategic alignment to global goals and the STC. It's important not to have investments spread too thin. This is especially important for focus portfolios, which by their very nature have limited investment envelope. So while the investment should be poised for impact and sustainability, they don't need to speak to every area to the strategy. On the other hand, the program supported by investment should speak to much more of the strategy. So the focus of the section is on program, not only the Global Fund investment. Question 2.1. Linkages to NSP and its goal and objectives, as well as global disease-specific goals and objectives, are critical. Remember to consider top 3 to 5 ways the program is already aligned with the TRP review criteria. As a reminder, TRP review criteria are available also on our website. Again, this question is narrowed in to look at the focus areas indicated in the allocation letter. So, for example, all applicants will need to look at the environmental impact of the program that are investing and are going for area-specific allocation. So, if the focus of funding request on prevention is on prevention for key and vulnerable populations, then the environmental impact question should only look at the part of the program that works on prevention for key and vulnerable populations, even if only a part of this program is covered by investment from the Global Fund. Environmental impact for interventions for general populations would not need to be considered. Remember also to pay close attention to what is being asked in details column. Many are considered, but the questions element on environmental impact has very specific points that should be addressed and that is the focus area for your environment. 2.2a, sustainability. Applicants aren't asked to describe every sustainability achievement or challenges. Instead, we are asking you to describe the most prominent sustainability achievement or challenges, and to detail out how they are working, how you will be working to maintain or address them, with Global Fund support as needed. We are also asking you to consider different dimensions of sustainability, including financial, programmatic, health and community systems, and governance. National health sector financial plans are important to reference here, and the STC guidance note, as well as value for money technical brief, are important guidance for applicants. Co-financing, this is not a new section, this is something you have seen already before, but just to reiterate, this section focuses specifically on how and to what extent the country has realized the co-financing commitments made during the 2020-2022 allocation period, and how the country will increase domestic financing and co-financing for the national response and health system throughout the 2023-2025 allocation period. It's important to consider co-financing requirements and refer to domestic financing section of the allocation letter. There will be specific information included there. Also, it's not required until grant making. Applicants are also encouraged to include commitment letters if they're already available. Next, yes, please. Innovative financing. So this section, you should only describe if relevant. Innovative financing approaches include debt to health and joint investment with development partners prioritized within the Global Fund strategy. If you think an innovative finance modality might be appropriate in your case, please consult with your country team as early as possible. Section 3, implementation. Focus of this final section, so we only have 3 sections. Focus of this final section, section 3, is on implementation. Section looks on how the requested interventions will be effectively implemented. If changes to implementation arrangement are envisaged for the implementation to be more effective, centered in communities, and how this will ensure that certain risks have been mitigated. In alignment with the Global Fund's risk policy, there aren't separate questions related to risk here. Rather, risks are considered both in terms of risk associated with not being good value for money, as well as risk of not using community-led and based organizations. As mentioned in the earlier question on payment for results, incentive payments should also be discussed here, but not in the previous section. We want to note that there aren't specific question or questioned elements related to incentive payments in this section, but instead, the implementation arrangements and risk for the implementation modality should be addressed and highlighted in the response to the question in this section. This is also outlined and detailed out in the instructions. 3.1, implementation arrangements. This is a very important area for value for money considerations, especially related to effectiveness and efficiency of the implementation. Specifically, given the limited funding envelope for focused portfolios, this will be a key focus area for the TRP. And we also encourage reviewing funding requests from the last cycle because TRP and the TRP lessons learned where they refer to implementation arrangement as one of the key areas of interest. Community organizations. Evidence has shown that community-led organizations are often best placed to reach out to marginalized, discriminated, criminalized populations, which in the context of the HIV account for 70% of infections. Let's just remember that. Their role is therefore critical to end the epidemics. This section is important as it allows for CCMs to reflect on the role they are given to the community-led organizations in the implementing of programs. Therefore, applicants are asked to explicitly evaluate the value, opportunity, cost of using or not using community-led and based organizations instead of other stakeholders. They're also asked to look at and address barriers that prevent community-led and based organizations from inclusion and implementation. I will hand it over to David to cover the annexes.
Sorry, I just have to get everything set up here. There we go. Thank you so much. Now, get that off the screen. Okay, so we're starting with the transition annex. This is only been used in some cases. So this annex focuses on how the applicant will maintain service coverage and sustain gains achieved in the fight against the diseases, including service provision for key and vulnerable populations, as these components move towards full domestic financing and implementing their programs without Global Fund support. Please note that some of the questions do not need to be answered if a payment for results modality is being used. You can look in the instructions, which, as Svetlana mentioned, are already available online to see which one of those questions are not needed if payment for results is being used. Annex questions A and B. The transition funding request may include, among others, activities to enhance sustainability and support the transition of effective, evidence-informed services for key and vulnerable populations. We can also include enabling or scaling up government funding of non-state actors, specifically civil society and community organizations, securing the availability of robust programmatic and financial data for program planning and monitoring, strengthening the effective domestic procurement of quality health products, and or the strengthening the procurement process in general, or enhancing the financial sustainability of Global Fund supported programs. So there's a lot of different things that can be included in this. And remember, we have a session on November 30th where our colleagues who focus on health financing, they will be going through this annex and other topics related to sustainability, transition, co-financing, and innovative financing. And they'll go into what kinds of activities can be included in transition work plans and what should be considered by countries, regardless of how far they are from transitioning. Questions C, D, and E. With question C, applicants are asked to list activities or challenges identified in the transition work plan that will be funded by the Global Fund and explain the source of the funding for these activities going forward. Applicants should also list any foreseeable challenges that may affect the smooth transition away from Global Fund financing, and then explain how to address those challenges. Question D, they're asked how service provision, such as human resources for health, procurement, or other activities will be covered from domestic resources or absorbed by national health authorities by the end of the transition or the grant funding period if they're funded through by the Global Fund. Question E, they're asked to explain how these main program functions will be absorbed by national entities by the end of the implementation period and how they will be funded moving forward. So that was the transition annex, short and sweet. We have the other required annexes for focused and transition. So we'll start by looking at those that are required, and then we'll look at some that are only needed in some cases. So among those that are required on the top row, we have these annexes that you're already familiar with and that have been updated for the cycle. In the middle row, we have some annexes which are new or which have had substantive updates. And then finally, in the light blue, we have annexes that mostly need referencing, compiling, or assembly. And we will go through each annex at a high level, but we refer you to your country team if you have detailed questions on these. Starting off, we have the performance framework. Now, it provides indicators for impact, outcome, and coverage. My notes are being blocked, just a second. And it includes work plan tracking measures when coverage indicators aren't possible. An important change for this cycle, mirroring the similar change in the modular framework handbook, is that modules and interventions are now by population. And so, for example, with TV programming for key and vulnerable populations, that's a module that has separate interventions for people in prisons, migrants or refugees, minors and mining communities, and the urban poor. So one module with different interventions by different populations. Other improvements to the performance framework include built-in error reporting and reverse indicators with appropriately declining targets over time. There will be a webinar on the performance framework as well as an e-learning, both of which are expected in January of 2023. We have the budget. The budget is tied closely to the performance framework, and it shows the costs of what is prioritized for allocation funding. New for this year, the budget is being requested by year instead of by quarter. Both the budget as well as the performance framework we just talked about are generated for each country by their country team following the allocation letter. This is not different from the previous cycle. To note, we are also planning a session, webinar, as well as an e-learning on the budget again in January of 2023. We have the prioritized above allocation request, or PAR. This is submitted with the funding request, and it outlines specific modules that the CCM would implement if the funds became available. Now, these prioritized and costed modules and interventions included in the PAR are evaluated by the technical review panel, and if they're approved, they're placed on the register of unfunded quality demand. You'll see that UQD used sometimes. These modules and interventions can then be integrated into grants when savings or efficiencies are found, either through the grant-making process or during implementation. Similar to the performance framework and the budget, the PAR is generated by the country team and is sent to applicants. And it's important that the most critical modules and interventions for programs are included within the main funding request. And the PAR is a mandatory submission at the time of the funding request submission, even if it only has one item. Now, applicants may submit an updated PAR during grant implementation, but only with agreement of the Global Fund in very specific cases. And these are if it is justified by significant changes to the country context, or when there's a realistic expectation of additional funds becoming available. Now, considering the limited circumstances in which a PAR can be updated, it's definitely recommended to carefully consider what should go into the PAR before funding request submission. We'll have the programmatic gap table. These tables summarize country needs, national targets, and the gaps in programs that need to be funded to meet those targets. And this hasn't changed. And the tables do this by showing the change achievable by domestic and external contributions, along with the Global Fund support, and then displaying the needs and gaps in selected modules that are key to achieving impact. It also includes coverage targets, which is really helpful for helping prioritize what should be covered by the allocation and what should go in PAR. New for this cycle, we have an additional programmatic gap table for community health workers. And this is one table that looks across the 3 diseases and RSSH. Overall, the tables have been aligned with the new modular framework handbook. So they include some new tables, such as for severe malaria, and they remove some other tables, such as on male circumcision. We have the funding landscape table. This has been refined and improved for this cycle. It still illustrates the total funding need for the health program and how the country plans to come up with that money, whether through domestic resources, other external donors, and the Global Fund investment. It enables applicants to have a good idea of how much money will be needed to finance their health programs. It also makes it easier to see trends on how specific interventions are funded, which is very important for the sustainability of programs, especially those supporting key and vulnerable populations. Top changes to the funding landscape table for this cycle include a new health product page, given the amount of co-financing commitments focused on health products, as well as the additional years of expenditures on co-financing pages to better see trends. The essential data tables. This is an Excel file that provides key figures related to country and epidemiological context. Applicants are asked to validate sections with pre-filled data filled by the Secretariat, and then to provide further information as indicated. The essential data tables aren't new, but they have been updated to include tabs which applicants are requested to fill in. These tabs will be used to establish the program essentials baseline for tuberculosis and HIV. Taking a quick step to look at program essentials as well as critical approaches. Program essentials are key evidence-based interventions and approaches to address the ambitious goals set out in global plans. Critical approaches are specifications for RSSH interventions, which are funded by the Global Fund. The aim of both program essentials and critical approaches is to drive uptake and adoption of evidence-based recommendations and best practices. For the TB and HIV program essentials, the data is requested in the essential data tables. For focus portfolios, though, no further information is requested beyond the data in the TB and HIV tables. More information on the program essentials and on critical approaches can be found in the respective information notes. As indicated in the strategy, we are meant to have people and communities at the center of everything we do. And one way to bring this to life is to make sure that we are hearing their voices and acting on their insight. An opportunity to do that is to have the expectation that civil society and community groups come together to provide a list of the top 20 areas that they would propose for the CCM to consider in terms of the most valuable investments that would make the biggest impact from the perspective of civil society and communities. And we're asking for this for 3 reasons. One, it's important and useful exercise for civil society and community groups to discuss what their priorities are. 2, it's a valuable input for the CCM as they consider the prioritization for their funding request overall. And 3, it provides insight to the Secretariat on how these expressed needs fit with the amount requested under the allocation and under PAR, as well as to see whether and how these needs are reflected in the grants themselves as it moves forward into grant making and implementation. And this will be a useful exercise for the wider Global Fund partnership for the next funding cycle. We also have the new country dialogue narrative, which allows the CCM to describe in writing how the inclusive and transparent country dialogue was undertaken at the funding request development stage. The evidence of how they ensured inclusiveness needs to be kept in the CCM's records, but no longer needs to be submitted to the Global Fund unless specifically requested. National strategic plans. The allocation-based funding model emphasizes alignment to country processes, and it aims to incentivize the development of robust, costed, and prioritized national strategic plans, as well as the overall national health strategy. With national strategic plans, we demonstrate the country's ownership of the disease programs. And here we're talking about national strategic plans, but there are a lot of other documents which have been adopted by countries that should be considered as well, a few of which are shown on the slide. Additional co-financing documentation. This is about additional co-financing documentation, as the core documentation is submitted at the time of the funding request and includes narrative on the co-financing included in the forms, the funding landscape table, as well as commitment letters. Ideally, these commitment letters are submitted before the funding request submission or at the latest by grant approval, but these commitment letters are a requirement for all portfolios. Additional documentation may include documentation for the current grants of realization co-finance commitments, such as expenditure reports, details on uptake of specific interventions, etc. And these will primarily be used to verify compliance with the co-financing requirements. Again, this topic on co-financing, as well as others such as innovative finance, sustainability and transition, these will be discussed in an upcoming webinar session we have on November 30th. We have the CCM endorsement of the funding request. It's fairly straightforward. Each member of the CCM is asked to endorse the final funding request. There's also the statement of compliance, which is on the 6 CCM eligibility requirements, as well as the focus of application requirements. As a reminder, on the eligibility requirements, the Global Fund screens the first two before the technical review panel. That's on the inclusive country dialogue and open and transparent principal recipient selection. And while we're discussing the endorsement, we have a small reminder to please make sure that the CCM contacts in the Global Fund system are updated and complete well in advance of the submission of the funding request. And CCMs can do this themselves. CCM Secretariat focal points are able to make changes themselves, for example, following elections, by raising a change request through the partner portal. And country teams may be reaching out soon to remind you to please update this information. So we saw the required annexes. And so now let's take a look at the annexes that are required only for a subset of applicants or which are optional. So top left, we have annexes that are only relevant in specific circumstances. Top right, we have an annex which is to be submitted if available for tailored for focused portfolios applicants, but required if the applicant is applying using the tailored for transition approach. Bottom left, we have other annexes which may be submitted if they are available. And bottom right, we have annexes which are optional, but may improve how applicants consider and plan their programs. Implementation arrangements map. This isn't new. It provides a visual depiction of the relationship between funds, organizations, and programs that are a part of a grant or a set of grants. And this is required at the funding request stage if the CCM has selected the current principal recipient to continue managing the program, but it can be submitted during grant making if a new principal recipient has been chosen. Innovative finance documentation. The exact documentation for this will depend on the mechanism that is used. If you're interested in innovative finance, please attend the session on November 30th. We also have the sustainability and transition supporting documentation. Applicants may include the transition readiness assessment, the transition work plan, the sustainability assessment, sustainability plan, if available. And this information is, if available, for most focused applicants, and it is required for transition countries. If these documents are not available, but other documentation exists, which demonstrates efforts to strengthen sustainability of national responses, these can also be included. And if available, please also include any materials that substantiate government efforts to strengthen health financing, as well as financial sustainability. We have the human rights assessment and the gender assessment. Both of these are if available. So evidence has shown us that we will not defeat the 3 diseases unless we remove human rights related barriers and increase gender equality. The new strategy is very clear on that. And we know that many CCMs, civil society and governments have already worked on human rights assessments and gender assessments on finding ways to address these barriers and to increase gender equality. So our request is, if these assessments are available, please attach them to the funding request. In particular, the gender assessment is an analysis which helps inform the request and is used to measure progress towards gender equality goals. No standard template or format is requested for either the human rights assessment or the gender assessment. But inclusion of the gender assessment is a core part of being able to achieve a higher score in the gender equality marker, which I'll share on the next slide. Now, the gender equality marker, or GEM, as you may see it abbreviated, will be assessed on each funding request that's reviewed in the 2023 to 2025 allocation period. And it's basically a checklist to incentivize, to track, and report on how the grants contribute to advancing gender equality. For this allocation period, the GEM score for the funding request will be assessed by the technical review panel. And we want to emphasize that the score is to help establish a baseline. Applicants won't be penalized for having a low score, but instead they will have specific areas which they can look to for improvement in the next cycle. We have the RSSH Gaps and Priorities Annex. This is a new annex that encourages the 3 disease communities to have a joint data-driven discussion on RSSH priorities and gaps. And we want to be very clear that this tool is not required for focused portfolios. If you look at the handy checklist that's at the back of the application forms or the instructions, you will not see this one there. But it is a great resource nevertheless, and it may be useful for some focused portfolios. The aim behind it is to have a deliberate approach to ensure that joint decision-making and ownership of disease programs of their investments in RSSH. And while we know that many focus requests may not include RSSH investments, these investments might still complement domestic finance programs, and this complementarity may be better coordinated through the use of this tool. This tool is further discussed in the Country Dialogue Expectations session, which happened a few weeks ago. You can already watch a recording of that or download the slides on iLearn. Finally, the last annex is the Sexual Exploitation, Abuse, and Harassment Assessment. And the Global Fund is very intentional about exploring further how we can protect against sexual exploitation, abuse, and harassment moving forward. And this is sometimes abbreviated to SEAH. For the upcoming cycle, 10 countries will be requested to submit the assessment of SEAH. Details on which countries will be selected, how they will be notified, and what kinds of support will be provided very soon once it is finalized. For all other countries, a template of this is already available on the Global Fund website. If countries want to start looking at that and thinking about how they can make sure that their programs are best protected against SEAH. And it is not a required annex except for those 10 countries which are identified for the pilot, which we will be communicating about soon. So finally, we have a reminder of the technical review panel review dates and appropriate submission dates, at least for next year. These are already available on the Global Fund website. And we'd like to remind you, as you are planning which windows to submit to make sure that you leave enough room for grant making. Experience shows that we need to account for 6 to 9 months for the funding request development and grant making, depending on country context. And the recommendation is to try to build in time between the signature and the beginning of the next implementation period to complete implementation readiness. So for example, ensuring that all the implementation subrecipients have been contracted and are ready to go on day 1 of the new grant. And this may require signing the grant 1 to 2 months before the implementation period starts. But by having that time in between, you can better be prepared for that next cycle. And so what you can do now before the allocation letters are even received, you can start doing the analysis of the human rights assessments, so the funding landscape table, programmatic gap table, et cetera. And you can start gathering that data, analyzing that data, and then so that you can hit the ground running when allocation letters start going out at the end of this year. And so with that, we will go to the questions. I can see that we already have some questions coming up. So before I get to that slide, I would just like to remind you all, we already have a frequently asked questions document that is available on the website in English, Spanish, and French. The applicant handbook was just published. That will also contain a lot of answers to questions. Translations in Spanish and French will be available hopefully quite soon. If you do have additional questions at the end of the day, please email them to us. The questions that are asked today will be used to update the frequently asked questions document. And so you can also look there as a reference moving forward. And so with that, let us go to our question slide. So question number 1, how does the Global Fund support NGOs for technical assistance dialogue and their related activities? And so I see my colleague Gilles hopping on to help answer that question.
Thank you. Hi, everyone. Yes, very good question. Thank you. And I responded to Ulrich in French in the chat. But so the Global Fund has several mechanisms to support NGOs, and I would go beyond NGOs actually and include community-based and community-led organizations, especially community-led organizations which are key populations-led. So we have several mechanisms. The first one is we have a specific dedicated technical assistance mechanism, which is called the Community Engagement Strategic Initiative. And you can find information on the Global Fund website on how to access this technical assistance mechanism, which is a mechanism of technical assistance to support communities in the broad term during the country dialogue and during any processes which are very important in the context of the Global Fund and the fight against the tree diseases. So that includes technical assistance to help communities get together and prepare their list of priorities, for example, for this funding request. But that could be also any support needed by communities to gather data, to analyze data at country level, to really help you advocate for your priorities during the country dialogue. So that's one. And maybe, I don't know if my colleagues or I can do that later, put in the chat the link to the webpage for this, where you can find all the information on this technical assistance for communities. Another way that we support communities community-based organizations is through the grants. So you will see as part of the package for the application that the modular framework and the info notes, the information notes, include several interventions which we call community system strengthening. So they include community-led monitoring, institutional capacity building of community-led organizations and community-based organizations and NGOs, but also supporting community-led advocacy and research and social mobilization. So all these interventions are eligible interventions in the Global Fund grants. We are already in this current cycle supporting a lot, and we want to further increase our investments in community system strengthening. And you will find all the information around which interventions exactly are we speaking about, what is eligible, what we should maybe consider in your CCMs to include in the funding request for Global Fund financing. So that's another way that we provide some support there. And also, I would say we provide support in giving visibility and voice to communities, because as you've heard and you know, our CCMs need to have communities at the table. So it's a requirement. And so by doing so, the Global Fund Partnership is really also giving this opportunity to NGOs, community-based organizations, to be sitting at the CCMs and raise their concerns during implementation, but also raise their priorities during the funding request stage. So I will stop here, David, and I hope that responded a little bit to the question.
Yes, thank you, Gilles. So actually, while you are still on camera, I think it would be a good time to ask question 3. So is there a requirement that the 20 priorities identified by communities in the new annex that they be funded?
Thank you. Yes, and thank you for the question. That's a question that we get a lot, actually. So the short answer is no. There is no requirement that the 20 priorities, which were identified by the communities, are funded. This annex, the objective of this annex is really to have communities get together and get to a maximum number of 20 priorities. It could be less, and like I was writing in my answer in the chat, I think the more these priorities will be evidence-based, very strategic and focused, the higher the chances that they are included in the funding request by the CCM, will be higher. So the short answer is no. It's an annex that we are going to use, the CCMs are going to use. So it's going to be produced by the communities during country dialogue. It's going to be shared with the CCMs. It's going to be attached to the funding requests when the CCM will send the package to the Global Fund. And it's going to be used by the Global Fund teams when we review the funding request to assess if we are missing some critical gaps that were captured by communities in their priorities. So it's going to be extremely useful, but there is no mandatory requirement that all the priorities are funded.
Thank you, Gilles. And I think I will ask question 2 to you, Svetlana, and maybe to Lindsay if she wants to hop on. But is the transition annex the only annex that is unique to the tailored for transition applications? Are there other annexes the same as for the full review?
So for focused for transition application approach, we have this specific transition annex, and applicants are also requested to submit the transition work plan and transition readiness assessment. For other annexes, they are similar to the full review. However, similar to the full review, human rights assessment and gender assessment are not mandatory annexes. We only ask you to submit if you already have them available. So they ask to submit if available. And for RSSH specific annex, this is not a mandatory annex for focus portfolios. This is mandatory annex for full review, however, but encouraged to submit if you have this information. Over.
Thank you, Svetlana. And then I think it might be the time to ask Lindsay for question 4 and 5. So when will CCMs be informed about which application form to use? And then I will try to provide a quick run through of question 5 so that those who are listening in French and Spanish can know what is being asked on screen. So I've heard that some Global Fund country teams have already engaged consultants and have begun conducting transition readiness assessments. If a country and component finds out that it's going to be put on a transition grant in December, will there be time for those CCMs to engage technical assistance or request assistance from Global Fund country teams to conduct the assessment so that it may be included as part of the funding request? It's a long one, but it's on screen.
So David, did you want me to answer question 4?
Yes, please.
Okay, so question 4 relates to when will applicants actually find out which of these different application types, application forms they should be completing, they should be filling out. And the short answer to that is applicants will be informed which application they should be completing in their allocation letter. We still hope to be able to send out the allocation letters in December, as we have in previous funding cycles, noting that the Global Fund Board still needs to make a decision on the sources of funds for the allocation. So that has not yet happened. So the allocations have not yet been determined. So we have not yet completed the actual analysis to then be able to make a decision on the application approaches yet. However, we're still, all things considered, hopefully on track to be able to do that and have the allocation letters ready to be sent out in December. That being said, there are a number of different factors that applicants can already be thinking about so they can have a good idea which application they are likely to be requested to use. And one of those is their portfolio categorization. So David, could you actually find somewhere in the backup slides the slide that shows the portfolio categorization for the current allocation period? So I will note that the Global Fund portfolio categorizations are updated every 3 years for each allocation period. So the Global Fund portfolio categorization will also be updated in the next month following the allocation decisions and will be published on the Global Fund website in the operational policy manual. So that's a publicly available document. But that being said, usually the countries that are currently in the focused portfolio categorization do not change. And so it's highly likely that the countries that are re-eligible for a Global Fund allocation who are currently focused will remain in the focused portfolio and can assume that the majority of those will be using the Tailored for Focused Portfolios application. So as you can see on the left-hand side, roughly half of the Global Fund portfolios are in that focused portfolio categorization group. So that cohort, and we see there's 49 countries, that cohort of applicants can assume that they will be completing the Tailored for Focused Portfolio application because that's used for both the focused portfolio and those invited to use the Tailored for Transition application if they are likely to be transitioning from Global Fund financing in the near future. The applicants, the CCMs who are part of the core and the high impact portfolio categorization on this slide are more likely then to be in the full review or the program continuation, or maybe even the tailored for national strategic plans category of application. So as we are talking about the focused application today, I would just direct you to the group of countries on the left-hand side. Those countries are likely to be using this application approach. Okay, so that's the answer to question 4. Thanks, David, for showing that. And then related to question 5. So as we were just talking about the tailored for transition application, there are a number of different criteria by which the Global Fund would request that a country would use the tailored for transition application, which is the focused application we were just talking about, plus the transition annex. And in addition, we would expect those applicants to think through and have able to share with the Global Fund at the funding request stage a transition readiness assessment and a transition work plan. There are no standard formats for those. It doesn't need to be done in a specific Global Fund way. This is information that would be important for the country to work through as it anticipates moving away from Global Fund financing in the near future, whether or not that's in the next 3-year period or in the next 2 allocation periods. So the question relates to if a transition readiness assessment is requested as part of that transition package, is there enough time to develop it? And the honest answer to that is yes, there is enough time. It requires some thinking. It requires definitely some documentation of some discussions that very likely have already taken place. But it is not an onerous task to do. Does not require technical assistance, although that could be helpful. And frankly, many of the countries that could be invited to use the tailored for transition approach are not going to be coming to window 1, so there is more time. Many of the countries that come with a tailored for transition application happen to be in the funding cycle that has a later submission time frame. Based on when the grant life cycle has the current grant ending, that's when they would need to think backwards for their funding request for the next funding period. So hopefully that answers your question, Anthony. And if you have a follow-up question, happy to answer that as well. I don't see any other questions in the chat, but if there are questions, you can put them in the chat in English, French, or Spanish, and we would be happy to answer those.
And so as we are waiting for any last questions to come in, a kind reminder to everyone who's joined us today that a recording of today's session will be available soon on iLearn in English, Spanish, and French, as well as a copy of the slides. So if you have not already received the slides, you'll be able to download those soon. Some of the questions from today will be used to update the frequently asked questions document, which again is already available online, as well as the applicant handbook on the Global Fund website. And
I think we're fine. I don't see any more questions, which would indicate to me that either we've been very clear or that people have other things that they need to get to this afternoon. But if we don't have any other additional questions to answer that have come up in the chat, I think we can say goodbye.
Thank you all so much for joining us today. Hopefully we will see you at a forthcoming webinar, either on sustainability, transition, co-financing, and innovative financing, or the updates to the information notes, including the program essentials and critical approaches. Thank you and see you soon.
Bye-bye.
Bye.